if I could have done this when I was 30, my life might have been a little bit different, and I probably have more of my own teeth. So I was very encouraged, and I would encourage anybody else to seek it out. I've told multiple people that I work with that are having problems. I think it's probably common in my profession for people to grind and clench. This is a great place to come. My name is Mary Minden. I'm from Bucyrus, Kansas. I'm a nurse anesthetist. I'm a mom. Fatigue, constant fatigue. I never feel rested. Even after I sleep a full night, I do not have any energy at all. I'd say in the last 5 years it's increased significantly, but I've never felt really like very rested. Like I've never woken up in the morning and left. That's 0. That's every day. I wish I could just stay in bed, but I'm also to the point where you can't continue to stay in bed because it's not helping at all. I don't feel rested after a nap. I don't feel rested. So sometimes lots of times I just get up in the middle of the night because I can't sleep and I'm just so exhausted. I'm just trying to find some way to relax. Maybe 10 o'clock in the morning, 3. And then by 2 o'clock, I'm about done with the day. The jaw hurts in here all the time, back in the ear, up through the face, sometimes across to my lips, up around the eye. Just this whole side just hurts all the time. Swollen in the morning, usually just constantly there. Over the years, as I've lost teeth and had different crowns and then bridges and different things, that's affected it. And each time you think it's going to get better, and it's just like I'm just losing tooth after tooth, and now I'm to the point where it's not better, it's worse than it's ever been, and I hardly have any of my own teeth on the left. Some days it's worse than others when I first wake up. Like today, it's really bad today. Probably I'd say 7 or 8. I can function, but it's just nagging. I tried not to take Tylenol, but I have a headache, so I had to take some Tylenol because I just can't think if I. Some days it's probably 2 or 3, but it's just there. It just feels kind of sore, and I don't need Tylenol on those days, and I don't usually have as bad a headache with it. Well, I've tried ice, I've tried cool, I've tried massage, showers, Botox.
How many times Botox?
I've probably had Botox maybe 6 times in the masseter muscles. Well, it helps at first, but then as it wears off, it makes it worse. Then I think sometimes as it wears off, it's uneven as it's wearing off, and that's really not helpful, especially if it affects this side more than this side, or, I'm not sure. But sometimes my jaw will feel not level, and I think some of that has to do with the Botox as it's wearing off, maybe. I don't know. Eating things that are difficult to chew, like meat, or things that are really hard. I don't chew gum ever. I don't chew ice ever anymore. Sometimes bread's hard, like if it's a hard outside bread. Anything hard like carrot or apple or anything like that is not. It's hard to chew because the jaw is so fatigued, and sometimes it just quivers because the muscles are so tired.
Anything on the right side at all?
The right side doesn't seem to really be affected, and the right eye is not affected. The right jaw doesn't hurt. It's all on the left, and it's in the left neck and left shoulder. And I get trigger points on the right, but I think, you have the yin and the yang of your side, so I think it's a response to that. But it's the left side. Yeah, the headaches have been, I have a headache every day, and it's in around this eye, and sinus in through here, and it goes back to the ear, and you know, it's hard to separate the jaw from the face and the head. But I've had some migraines this month that have been pretty bad. That's been the entire head. I've gotten massage for that. I've done steam, you know, to try to relax. And the sinus on the left side feels very raw because my nose runs continually. It's always on the left, the right side. It doesn't, it's the left side, it runs. I'd say in the last 10 years, I've probably had a headache at least 50% of the time. And over the last 5 years, it's been increasing. But some days I wake up and it's probably 5, 6. And then when it's really bad, probably 9, I have to go to bed. That usually starts out as a visual in the left eye where you get like a bright light shines in the left eye. That's when I first noticed it, when a surgeon's headlamp, he caught me in the eye with it, or when I used to scrub and the lights are bright and they'd come off the blue drape, and it would just trigger this amoeba-like motion in my eye, and then it expands to a headache that's, you just feel like if you could take the top of your head off, you could release that pressure and you would feel better. I just have to go to bed. I get sick to my stomach sometimes. I just don't feel well. There's nothing you can do to make it go away. In the last month, it's happened 3 times. Before that, it was very sporadic. Well, and I try very hard to not, like when I'm at work and stuff, and the surgeons have their headlamps on, they're looking around, I try to really avoid that. I wear my sunglasses outside all the time because I don't want that. I try to avoid it. So my neck is very stiff and sore, and it radiates into my left shoulder and into my hand. I get massages a lot for that. I get trigger points. Sometimes I have, like the massage, it's like the focus of the day to get to the massage because I know it will help relax and release that tension. I'd say, I don't know, 3 or 4. It's just always there. It's not incapacitating, but it's grinding. It's always there. It all adds to the fatigue overall because you can't make it go away. You can take the Tylenol. I can't take Advil, but you can take Tylenol, and it helps take the edge off, but it doesn't go away. And I've tried muscle relaxants. I've tried Valium, and it makes the muscle relaxant and the Valium both made the grinding worse. So it exacerbated it more instead of making it better. The left, you mean particularly the neck, the worst it probably ever gets is about a 5, and if I go get the massage, it's really sore for a few days, like muscle soreness, and then it gets better, and then it slowly builds back up. Sometimes I get a massage every week, depending on how I feel and my schedule, and if I can make it work. And I go to this certain one that kind of understands what I have, and it'll last about a week maybe. If I could go on every other day for a while, that'd be great, but that's not feasible. I can't do that. I can't afford it, and I don't have the time to do that. Oh, and my hands, I feel weak sometimes, you know, when I have to move the operating room bed all the way up so I can use my shoulders and my upper body because I don't have strength in the arm to open up the airway like I did before. I feel a lot better. A lot of the pain is gone. Headaches gone, are pretty much gone. The swelling of the face in the morning is gone. Neck feels better, shoulders feel better. Just pretty happy about it. I would take a gram of Tylenol every morning when I got up, and usually when I got home from work. I've probably taken Tylenol twice. I always take a gram. I don't have any jaw pain, just kind of some awkwardness with the new position of the jaw, adjusting to it, but no pain. I'd say 100% change. I feel like I have a lot more energy, and I still am ready to go to bed in the evening, but I feel like I'm doing better in the afternoons than I was. I'm not completely out of energy by 2 o'clock like I was.
Anyone else notice this?
My family's noticed it too, yeah. Not really any headaches now. I used to have a constant headache, wake up with it and it'd be there most of the day, and the jaw fatigue most of the day, and I'm not really experiencing that now. 100% of it's completely gone. I don't know.
Hard to believe.
Yeah, it is.
Okay.
Well, I used to have a lot of pressure behind my eye and in my sinus, and the left eye would be especially sensitive to bright light, but my eyes are sensitive to light anyway, but it's the left one especially, and I haven't experienced really any of that.
So percentage on the eye?
I'd say 100% on that. My neck and my left shoulder used to hurt, and it would radiate into my left hand, and tingling and kind of a weakness. It's not completely gone, but it's a lot better. It's not to the point where I feel like that I need a massage all the time, or I need a heating pad on it, or I have a little therapeutic gun that hits trigger points, and I haven't used that once.
You used to use it?
I used to use it pretty much daily. I haven't had any problems intubating. When the neck pain and the shoulder would get really bad, sometimes I would feel really weak with that motion, and the last time I intubated, I was like, wow, this is nice. Well, I can't say 100%, but I think that greater than 50%, I mean, it's been a huge change. I just think overall I feel a lot better. I feel like initially the jaw, I was trying to figure out where it is you're supposed to line up, and I just feel like it was a lot easier than I thought it was going to be, and I'm really optimistic going forward and excited about even more progress. I wish I would have known sooner. Well, the constant grinding and clenching of the teeth and the fatigue that results from that over time, the chronic condition of it. Very low energy, probably 2 at the most days prior. I'd say now I'm probably 6 or 7. Put things on my list and get them done for the day, where before it was just too much energy. Didn't go places with my family because it was too much energy, but mostly just worked and laid around. But, I took care of house and cooked and stuff, but not vigorously. And now I'm much more active, working outside in the yard, going places, went on a trip. We went to Venice, and we went to Florence, and we went to Sorrento. We walked and walked and walked and walked, went on a boat ride out to the Isle of Capri. I mean, we just were constantly busy from early morning until, they ate dinner late there, so 10 o'clock at night we were out and about. I couldn't have done that before. I wouldn't have been able to keep up. Probably 65%, I would say. Jaw pain, it's improved significantly as well. Still have some days I have a stressful job, and some days, I clench. It's still something I'm working on, but it's also improved. I actually have been sleeping through the night, so that's a huge help. And when I wake up, my jaw doesn't just feel like it's so fatigued that it just, I haven't had any of the quivering in my lip or the numbness in my lip, and my ear pain is pretty much resolved. I'd say it's not perfect yet, but it's probably 50 to 70%, somewhere in there. I'm not sure. It's just day to day is still different, but much improved. Don't have much ear pain anymore at all. Before it would hurt all the time.
There is a headache, migraine on your...
Oh, the migraines, I used to have probably 3 a month, and I maybe have had 1 in the last year. So that's significantly improved. I still have the eye things that go on, but that's probably something totally different related to light and the reaction of the eye from it. But as far as my face being swollen and my eye being swollen, that's at least 70% better, I would say. The neck and shoulder is much better as well. I still get stiff, but I think, you know, I hold my stress in my shoulders. And but I'm not having the numbness in my hand that I had before, which was from the neck down. I haven't had that for months, which is really nice, and the strength of my arm is good, so that's a huge improvement. Well, I use my left hand to put airways in patients as part of my job, and you need arm strength in your left arm to be able to open the airway up, and I'd say that's probably at least 75% better. I still get stiff, but I think this is my stress response, and then clenching is part of it, and I just try really not to do the clenching part. Well, I work in a much bigger facility and a higher acuity facility than I did when I first came here, and I couldn't have kept up before if in this newer job. There's a lot more walking and pushing carts and pulling patients and sicker patients, and I wouldn't have been able to do it before. I just think overall I feel a lot better in general. Yeah, I really didn't know what to expect when I came in because I'd seen so many different people along the way and been told this was going to fix it, that was going to fix it, and it never did. So my hopes were high, but also I was thinking, oh, it's just going to be another Band-Aid. And it's not. We've done a lot of work in many aspects, and I'm very excited to see what it's all like in the end. So I used to have a lot of fatigue and facial pain and headache. I had multiple teeth where the roots ended up being cracked, all from grinding my teeth and clenching. So finally I found Dr. Raman's office, and I've had the total mouth reconstruction, and I would do it again in a heartbeat. It's not fun to wear braces, especially when you're my age, but it's totally worth it, and I feel better, and I feel like I look better, and I have more energy, and I'm not having headaches, and I highly recommend it. I came here after visiting my dentist, and I had facial pain, and my eyes, this left eye was really bothering me, very light sensitive, and a lot of pain in my eye and sinus. Oh, I am a nurse anesthetist, and I'm in an environment where there's a lot of bright lights, and my eyes were, especially the left one, so light sensitive. By the end of the day, my head would hurt, and I would just, you know, be completely worn out. I think maybe from squinting a lot, and also from raising my shoulders. Because I had so much tension in my neck from the grinding and clenching, that I would have numbness and tingling in my hand, and I would lose strength in my left hand from, I guess, trigger points pressing on nerves, and that was very uncomfortable. My index finger and my second finger were numb a lot of the time. So, you know, in day-to-day life, that's not so great, especially when it's the hand you need to do your job. Let's see, we thought we had, you know, I've been to the eye doctor multiple times because of my vision, and it got so bad that the cornea would swell in this eye, and at one point they thought I had a contact lens that was stuck in there. It was a big mess. And I had iritis multiple times in that eye. I've been to the masseuse like a gazillion times for my neck. I was contemplating going to see an orthopedist or a neurosurgeon I thought maybe I had some kind of stenosis in my neck to cause this in my arm. I went to multiple people that were supposed to be experts for dental. I went to my dentist. I've had probably 5 different dental appliances over the years to wear at night, which doesn't solve the problem. You just continue to clench and grind on that. It does help your teeth, but it doesn't solve the overall problem, and the symptoms continue. And you just, oh, it's stress, it's what, instead of anybody giving me some kind of solution. And there's a lot of fatigue that goes along with that because you're not sleeping well. My face would just be so tired that then it was hard to eat. And just overall, it's probably more common than we think, because I'd already had braces twice, once as a kid and once as an adult. So I think they've straightened the teeth out, but they didn't make it functional. So I lost a lot of teeth. I had multiple bridges and multiple crowns from the damage done to the teeth. And I just didn't feel like doing a lot because I was tired all the time. We did some scans and some muscle work and some balance work, and besides just my teeth, that makes sense because you're a whole person. And so trying to figure out where the imbalance seemed very sensible to me, instead of just looking at the teeth and going, oh, this is uneven, well, I'm sure that has something to do with it. But then the musculature and everything else get involved, especially over time. I mean, I'm older. I'm sure that if I could have done this when I was 30, my life might have been a little bit different, and I probably have more of my own teeth. Well, I wanted the whole thing done. I feel like I'd struggled for long enough, and I wanted my teeth to look nice, and I just wanted it to be corrected. Well, they put the appliance on, so obviously then my teeth kind of fit together differently. I was resting better and not having headaches, which is huge, and not having all the facial pain. And I just thought, well, if we can get even better, let's try it. I mean, I don't have anything to lose at this point, let's just go for it. Well, I had the braces put on, so people were like, you have braces? Do you have braces? And what? And I'm like, yeah, I have braces. There's a lot of adults I've noticed since I had the braces on. I've noticed quite a few adults that are getting their teeth fixed. And then we put the palate expander in there, and that's always fun because, it's pressure in there and your teeth are sore or whatever. But I mean, you see your teeth moving, and it gives you hope that you're going to come to the end and you're going to feel good and it's going to all be okay. And it has been. So, I didn't really care what other people thought. I needed to do what I needed to do for myself. And even though I'm in my 60s, I felt like, if I'm going to live 20 more years, I'd like to feel healthy and feel good every day. Well, I just think that it's wonderful to find a place that has a solution that, I was told by multiple dentists, well, there's no money in it, so dentists don't like to get involved in that. Well, isn't it part of your holistic dental care? I don't really understand the attitude toward it. They kind of just, we'll get you a bite block, we'll send you to the orthodontist. Well, nobody really wanted to work with me. And then when we came here, I was just like, everybody was very kind and everybody was very positive and shared their own experiences, and other patients seemed to be very happy. So I was very encouraged, and I would encourage anybody else to seek it out. I've told multiple people that I work with that are having problems. I think it's probably common in my profession for people to grind and clench. This is a great place to come. It's a process, but it's worth it in the end. I mean, it all makes sense. They explain everything, and I'm glad I did it. Very glad. Wish I would have done it when I was 30.